All right, I think we're good to go. So I will get started, and as more people join, hopefully they'll be able to catch up. So I would like to say welcome to everyone who is here to join us for our webinar on the impact of COVID-19 on the disability community. We know that this is a bit of a tough topic, but we so appreciate that you are taking the time to join us. We hope that you are coming to us safe and healthy and well. I just want everyone to quickly note that we are going to be recording today's webinar. I am Emily Ladau. I'm coming to you from Long Island, New York. I'm the Digital Content and Community Manager for the Disability and Philanthropy Forum, and I myself identify as someone with a disability. I'm really happy to be here today because I know that this is such an important topic, and I'm glad to be able to have such a wonderful, power packed group of people to share such important information with all of you. So quickly note that we are using a couple of key accessibility features. We have live captioning, which you can access by clicking the link in the chat box. And also, we're going to ask that speakers introduce themselves by name, and if they are providing any sort of images or if they are talking about anything visual, they will definitely make sure to describe those images. So again, we'll be hearing from three really powerhouse, wonderful speakers today about the disability community's response to the pandemic. And specifically, we'll be focusing on how philanthropy is so uniquely positioned to be able to support equitable responses to the crisis, both rapidly and looking ahead to longer term. So I'm incredibly happy to be joined by Maria Town, who's the president and CEO of the American Association of People with Disabilities, as well as Patrice Strahan, who is a core member of the Disability Justice Culture Club, and Nikki Brown Booker, who is the program officer for the Disability Inclusion Fund. So before each of them share their answers to today's questions, they're going to introduce themselves just a little bit more and also talk just briefly about the impact that COVID-19 has had on them. So the point of today's webinar is for each speaker to share their insights, their stories, and then at the end, we'll open it up to some Q&A. And in the meantime, please feel free to type any of the questions that you have in the chat box, or you can email them to my colleague, Allison Warner, who's helping to moderate this. She's at awarner@rw.org. That's awarner@rwjf.org. So that covers all of the housekeeping. Now let's move right along to the questions and the answers. So Maria, I would like to start with you. I'm very glad that you're here with us today. One of the most important messages that the disability community is working to convey is that our community is made up of more than 1 billion people worldwide, and COVID-19 poses such disproportionately high risks to our community. But also, we're more than just a statistic. I think people need to remember that we're family, friends, neighbors, colleagues, and in order to understand the very real impacts on people, we need to understand what it is that we mean when we say disability. So, can you shine a bit of a spotlight on how we're defining disability, who it includes, and then also talk a little bit more about some insight as to how the pandemic has been impacting you and your community?
Absolutely. Thank you so much, Emily. This is Maria. I'm honored to be here today. So the American Association of People with Disabilities is a cross-disability civil rights organization. And when we talk about the cross-disability community, we're actually talking about what it means to be a part of the disability community in general. A disability is any physical or mental condition that impacts an activity of daily living. So it can be everything from a mobility disability like I have, or a developmental disability, which I also have, to asthma, to someone experiencing cancer, or someone with a chronic illness. I think what's important to note about disability is that you don't have to identify as a person with a disability to be disabled. There are many, many people with disabilities around the globe who maybe just say that their hearing isn't as good as it used to be, or they just have that old injury that keeps acting up. And so part of the work that we do in the community is supporting anyone who falls into this broad category of disability, even if they don't claim the identity themselves. I think something that's very important to remember about COVID is that COVID will also produce disability. It is not a stagnant category or identity. So as people recover from COVID, we don't know what the long-term impacts are. And there may be disabling impacts of the virus that people are just now contending with. I think the other important thing to remember about COVID and disability is the mental health component. We've heard a lot about how individuals with and without disabilities are struggling with mental health, with depression, with chronic grief during COVID. That is all disability, even if it's not how we typically think of it. So we're talking about young children and the oldest of older adults all at the same time when we're talking about disability. In terms of how COVID is impacting me and my community, I think we're going to get into a lot of that during this webinar. So I want to give you a very personal answer. As Emily mentioned, people with disabilities are not monoliths. We're not islands either. We're friends. We're family members. My mother is a nurse in Louisiana, which has one of the largest outbreaks per capita in the country. And my mother would be very upset with me for indicating anything about her age because she's Southern, but my mother is older. She is in an at-risk category as a result of her age. And she is working on the COVID unit. So I worry about her all the time. But in addition to worrying about her, my mother, like many other mothers across this country, plays such an integral role in making sure that my family stays alive. I have a brother with disabilities who lives with her, and without being able to live at home, he would either be homeless or in an institution. And I have another brother who has recently lost his job, for whom my mom provides a lot of primary childcare. Because of the nature of our community and our family, it is almost impossible for my brothers and my nephew to isolate from my mother, or my mother to isolate from them. So in addition to worrying about my mother becoming exposed to COVID, I worry about my entire family becoming exposed. My mom needs to continue working because her job keeps the rest of my family alive. So that is how COVID is impacting me.
Maria, I want to thank you for sharing your insights. I know it's especially challenging to talk about a lot of these things, and I relate as someone, because my father is an essential worker. Both me and my mom are disabled. My parents are older, so it's a big risk party over here, if you want to call it that, as well. So I think it's really important for everyone on the call to remember, philanthropy kind of puts things at this 30,000 foot view sometimes. And it can be so easy to forget that these issues of equity that we're talking about impact very, very real people, individuals, with and without disabilities right now, even though people with disabilities are at such a disproportionately high risk. Patrice, I'm wondering if you can help us kind of focus on that more community level perspective, because you're right there working and organizing on the ground. So can you talk a little bit about how COVID-19 has affected you specifically, and then also how has it been impacting your local community, and really what creative support solutions and mutual aid efforts have you and your community been working on? I think that's so important for us to hear.
Okay. Well, how's everybody doing today? My name is Patrice, Patrice Strahan, and I'm currently one of the core members of Disability Justice Culture Club, a DJ collective located on Ohlone land in deep East Oakland, California. I personally identify as neurodivergent and have been involved in the work of DJCC since the fall of 2019. Um, and my personal connection to disability justice is all through the work that we've been doing with DJCC on various campaigns, events, and mutual aid efforts. For DJCC, the impact of COVID began before the shelter in place was instituted on March 16th in the Bay Area. Weeks earlier, we had begun to switch to Zoom for some regular gatherings and classes that we've been hosting, and we had already begun to create COVID care kits, which we were distributing to organizations that worked with unhoused communities and disabled folks and seniors. And then as events and conferences around the area began to cancel, we were able to connect with some of them and redistribute the meals that they had already purchased in terms of catering. Then the Friday before the shelter in place was issued, we moved quickly to recreate a mutual aid network to support seniors and disabled folks in our region, because we already saw the hardships that people were beginning to face in the storm that was brewing. We had already had some experience with this, organizing and helping to run a mutual aid network due to our participation in the Power to Live coalition last fall. That was a response to the wildfires and the PG&E shutoffs that were occurring and endangering the lives of seniors and disabled folks in our region last fall. As of today, we have been able to help over 100 individuals and have had over 400 individuals and groups support the network, either by signing up to be volunteers themselves or by donating funds and much needed supplies. The way the system works is that a core group of disabled and or neurodivergent organizers field requests that connect volunteers to the requesters in need of help. So the disabled are in leadership with this group, and it helps ensure knowledgeable and sensitive interactions with the requesters. And we're also able to operate in a way that supports our own needs. So when someone is helping out, but they need to step back, there's always space for that and understanding. No questions asked and no pressure to put on, no pressure to perform, even though it can feel like a lot of work. A lot of us have taken on a lot of hours to do all this. And the support provided to the requesters can range from purchasing and delivering groceries and medications to helping out with light housework for folks who are no longer having access to their regular support due to COVID, offering regular check-ins and phone calls if folks request it, and even to providing small mini grants to help offset the financial burdens exacerbated by the crisis. In addition to working with individuals, we have been able to work with and collaborate with other organizations in the area, like Community Ready Corps, which is a Black-led and focused community support group based in Oakland, has worked with us on everything from creating and distributing kits, providing skilled volunteers to support the network. We've also been able to redistribute resources that we get donated to other organizations that work directly with encampments and directly with encampments that we work with. East Oakland Collective and Poor Magazine come to mind. And we've also been able to receive donations from organizations that do food recovery. So we've also been involved with like redistributing some of that food and are trying to work to start a prepared meal service for requesters who are housing insecure or for some other reason, like the groceries wouldn't help them at this time. So we've all seen that the crisis has disproportionately endangered and impacted the lives of disabled folks and seniors across the world, especially Black and Indigenous folks. Some studies have shown that a fifth of the deaths are occurring in nursing homes, and we know that that data is not complete. And being immunocompromised has automatically meant lost income for many for whom telecommuting is not an option. But also live with family who may not be willing or able to shelter in place. So they're just literally having to hole up in their rooms in terror of getting sick. So in addition to the mutual aid network, DJCC has been hosting sliding scale online events and on COVID related issues, including a seminar on will writing and legal directives that had over 300 people sign up, and a justice brunch series where we were able to hire some artists and speakers who have had their work and income seriously impacted by COVID. So our focus has just been to try to think about holistically about the ways in which our community needs to be supported at this time, while also trying to think of ways to strengthen the connections and systems that could continue beyond the current crisis.
Patrice, I want to thank you for giving us such a deep dive and insight into the work that you're doing on the ground along with Disability Justice Culture Club, and also pointing out the intersections of how disability are of how COVID-19 is impacting multiply marginalized disabled people. I think it's really important for us to be recognizing on this call that while COVID disproportionately impacts the disability community, it even further disproportionately impacts people of multiple marginalized identities who also identify as disabled. And so we need to be incredibly aware of that within all of the work that we're doing. And so, Maria, now that Patrice has helped us center our focus with a community level insight, can you help us zoom back out a little bit and share with us some of the broader work that's being done at an organizational level around advocacy? Because I know that many organizations are working hard to advocate for policies around some of the major issues that are impacting the disability community, such as, unfortunately, healthcare rationing. So can you share some insight with us about that?
Absolutely. So as Patrice mentioned, we're seeing that nursing homes, and I'll say congregate settings more broadly, are one of the least safe places that disabled people can be right now. And so that means I'm talking about nursing homes, group homes, prisons and jails, psychiatric facilities, etc. And so one of the biggest priorities for the disability community is making sure that people can continue to live in their homes and in their communities, and that we do not see an uptick in admissions to congregate settings. We have really emphasized that crises are not times when you can waive civil rights. And so one of the reasons that we are really pushing for increased funding and improved policy around home and community-based services is to actually prevent further strain on our healthcare system and hopefully prevent discriminatory medical rationing that so many of us are concerned about. So a few of the things that we're advocating for in this context are increases in pay for attendant workers and care workers. We are also pushing for our caregiving workforce and our direct support professionals to be considered a part of the healthcare workforce so they can get access to the personal protective equipment that they need to do their jobs safely. If, again, more individuals can receive what they need at home, we will hopefully see less admissions into hospitals, especially for non-COVID related needs. So as the pandemic has progressed, we have seen states release what are called standards of care that determine how a state hospital system will prioritize medical resources if those resources become strained. So for example, in Kansas, we saw the state say that disabled people who use ventilators on a regular basis can have their ventilators taken from them in order to treat someone with COVID, and presumptively an able-bodied person with COVID. In Alabama, this has recently been changed, but we saw the state say that a person with significant developmental disabilities would not be a good candidate for life-saving care if they did contract COVID. But then in other states, we're seeing less explicit discrimination, but still concerning discrimination nonetheless. States that are saying that they will prioritize life-saving care on the basis of perceived long-term survivability and health. And as disabled people, we know how stigmatized our bodies and our minds are, and how difficult it is for people to understand that a disabled life is worth living. And so a lot of the policies more broadly that we're pushing for, again, are to keep people in their homes, to keep people out of hospitals, and to actually reduce the potential for rationing. One of the related issues that we're really focused on is making sure that people with disabilities can get access to medications and supplies. Many states and insurers have very restrictive policies when it comes to medication refills. The Centers for Disease Control currently says that individuals should be able to develop a 90-day backup supply of medicines in order to effectively socially isolate. But many insurers will only allow you to develop a 7-day backup supply, and that's it's even harder for individuals with disabilities who may be taking controlled substances. So we've also pushed for greater flexibility in medication refill policies, and we're now pushing against restricting access to medications because those medications are being redirected to treat COVID. So individuals with lupus, for example, are really struggling to get access to the regular medication they need to maintain their health because insurers are redirecting those meds to treat COVID. And we are pushing against that practice, especially because the science behind this just isn't there.
Maria, thank you for helping us understand better some of the major policy implications that the disability community is experiencing right now. And so I'd like to turn it back over to Patrice, because even as we are working as a community on innovative community solutions, and even as disability organizations are working on larger policy related advocacy initiatives so that we can implement change, I think it's also really important to be aware of the fact that working towards a more just and equitable society is more crucial than ever once we reach the end of this pandemic. And so, Patrice, what happens when most of society thinks that we've returned to quote unquote normal? Have we really returned to normal? And what role can philanthropy play in ensuring that we're not leaving disabled people behind as we move forward into this new normal?
Well, really appreciate bringing up this essential point that normal was never enough. Normal was never enough for all of us. Normal was an inherently ableist system where the value and worth of a human was based on their productivity and their normativity with regard to their ability to perform in a certain way. As has already been mentioned, the fact that very recently California, along with far too many other states, has issued these care rationing guidance instructions that instruct hospitals to reallocate resources to patients with better prognosis. It emphasizes what we already know, that in our society, our systems are inherently devalue the disabled, and disabled and senior lives are viewed as more disposable, and this is just not okay. Some current studies are showing that our economy at this point could take 5 to 10 years to recover. Well, what does that mean for the disabled community who are already disproportionately underserved and underrepresented in this economy, who already found much of mainstream employment inaccessible and had to rely on gig work and other relatively low wage work. And there has been a recognition that during this crisis there have been a number of changes to normal operating procedures that include considerations that disabled folks have been fighting for forever. All of a sudden, working from home is acceptable, encouraged, and supported. All of a sudden, it is possible to have that meeting via Zoom or have that class via Zoom, or when able-bodied folks needed it, now it can be provided, even though it was denied to disabled folks who had needed those accommodations for so long. But even still with these, it's important to notice that there's major discrepancies between those who have access to tech and those who do not. There are reports that show that 48% of upper middle class jobs can allow telecommuting, while 3% of low income jobs have a work from home option. It's not always an option. And NPR's had a recent study that showed that 47% of students still haven't been to an online class yet. Not everybody has access to these sorts of opportunities. When we started the COVID-19 Mutual Aid Network, one of the earliest requests that we received was from a low-income college student living on her own who had just been sent home to continue coursework on tech that she just didn't have. So besides tech access, these times have seen increases in things like mutual aid programs where members of the broader community work together to provide support for those who have insufficient support networks or none at all. And we've been glad to receive things like food donations from restaurants and bakeries that they themselves have been hit hard by the crisis. But when things return, what's going to happen to all that? Like, are they going to keep donating food to us every week? Are they going to, they're trying to figure out things for themselves. And it's been a beautiful experience to receive donations from individuals and groups from all over our region and beyond. But there's also something fundamentally disheartening about this, because it shouldn't be life dependent to see if a Boy Scout group wants to make some masks. Our systems are failed, and it's not okay to just jumpstart them and try to keep using them. They need a shift. There's no reason to rely on troops and volunteers to sew masks so people can stay safe, and there's no reason to rely on these temporary surpluses that some of these businesses have and their current ability to share them. The pandemic has also made it even more abundantly clear that as one of us goes, we all go. So one person's health and safety is all of our health and safety. And in these times and beyond, disabled folks need their access ensured, and their communities and support networks strengthened and supported. And these are things that philanthropic institutions can help with. Is there time to look at some pictures, or?
Yeah, you do. You have a couple minutes left if you want to share your screen.
So these are just a few pictures that show some of the stuff that's been going on with us. This one is, the picture above is a volunteer helping out with getting transportation access for someone who needs to go to an appointment. Below is a volunteer buying some groceries. Above and below is an experience where we connected a requester who was in need of yard support and some support in their home, with some volunteers willing to come out and help her with that. Here are some images of some of the donations that we were receiving. On the left is someone who had taken it upon themselves to like go to these bakeries and things, who had just like all these surpluses right now, and help redistribute them. And we were one of the recipients of a lot of really nice bread and pastries on a regular basis to redistribute. And then on the right is what I was talking about, of like this Boy Scout group that had made just dozens of kits and masks to redistribute. And so their troop leader came and brought it to us. You can advance. This is just to show a little bit of our history, how this is the picture above is from last year when we were protesting at PG&E about the power shutoffs, and that was also part of part of that organization was also with the mutual aid network at that time. And the one below is just a fun one, just to show that mutual aid is just part of what we do all the time. This was a birthday party of one of the participants in the mutual aid network, who dedicated their birthday just to mutual aid. And we, instead of having gifts, we all just cooked a lot of meals and distributed them. You can advance. And this just shows some of the events that we've been having. The Justice Brunch, where we were able to hire some disabled QT BIPOC folk to give a lecture during this time where a lot of their income has been really severely impacted. And then below is that legal document planning clinic that was giving information on care directives and will writing that a lot of folks were needing in this time. You can advance. And then this is just showing how that class that we used to host switched to Zoom. And then we were also talking about nobody is disposable, the campaign to show that these directives are wrong, and that, I mean, not these directives, these care rationing is wrong, and that nobody is disposable. That's all. Thank you.
Thank you so much, Patrice, and also thank you for sharing those images with us, as I think that, again, we need to remember that there are real people who are experiencing the impacts of this. And so as we are returning to a quote-unquote new normal, we need to remember that while mutual aid and community support is incredibly important, philanthropy absolutely has a role to play in ensuring that the funding goes where it needs to go. And so, Nikki, I'd like to bring you in now in the hopes that you could briefly give us a little bit of insight on how the pandemic has been impacting you personally, but then also talking about how rapid response funding from philanthropy is such a critical part of the solution right now. And tell us a little bit about how every foundation represented on this webinar can apply a disability inclusive lens to their rapid response plans.
Thanks, Emily. So for me personally, sheltering at home has been really a real challenge. I employ 6 attendants, caregivers on a regular basis. And, I've had to have really serious conversations with all of them about, their personal practices around safety with not only in my home, but also within their home. And, um, those are challenging conversations to have, because I don't want to tell someone how, how to live in their own space, but how they're living in their space directly affects how I am able to live in my space. Safety has been a really huge issue for me. I actually had to let someone go because they were not practicing, good social distancing. And so all of my attendants, they all work for other people. So if one of them gets sick and passes it on to me, they're literally passing it on to probably easily 30 other people. And most of those people are people with disabilities or caregivers who are working with other people. So it's really, you can really see how the spread could happen very quickly. Amongst people with disabilities who have caregivers on a regular basis. So, I've taken a lot of safety protocols, such as having them wear a mask and washing their hands as soon as they come in the house, and making sure everything gets wiped down when they leave. And I've even go to the lengths of having them change their clothes before they come in, right after they come into the house, so that because they're usually coming from someone else's home. So those are just really important things. And I also have a very elderly mom. She's 87 years old, and it's been, she lives 50 miles away from me. So I've been on the phone with her constantly, making sure she's safe, and trying to have groceries delivered to her. Just being worried about her all the time. And so, that, I think that takes a real toll on just having that stress and fear of not only what could happen to me, but what could happen to my loved ones. I come from a really large family. I'm the youngest of 8 kids. So we're all just trying to work together to keep each other safe and stay connected with each other. So, and kind of going on to the rapid response and answering your question about, I think when I think of rapid response funding with a disability inclusive lens, I kind of think about what we need, and what we need to fund. And I also think about how we make the process easy for someone to apply for the funds. So I kind of think about it in those 2 ways. So there's all kinds of work happening in the disability world. As we just heard Patrice talk about mutual aid, and Maria talk about policy work. And those are really, to me, those are kind of like the really big buckets of where rapid response funding needs to go. I see, and when I think about the policy work, I think a lot of times people think that, that these are, some of these policy issues are really, they're right now. So I think a lot of kind of people think that policy is a long-term process, but actually, You know, when we're talking about rationing of care and making sure people in nursing homes are well, I think that is a today issue. It's not like 6 months from now. It's not like a year from now. That is actually happening like right now, today. Um, so I think that when we're thinking about rapid response funding, I'm thinking about can we fund those programs and organizations that are working on those issues that are like right now. And I also think about if things like, so there's rationing of care, there's dealing with people that are unhoused or housing insecure, and also helping people maintain their quality of care while they're sheltering in place. I mean, that story is a real life story for me. And, you know, making sure that, you know, workers, caregivers are actually getting the pay that they need. That's a big policy issue. And
Actually, so, Patrice and Maria were talking. I don't mean to cut you off, but I just want to make sure that we get to the most important part of what you were talking about. Patrice and Maria were kind of talking about the things that need funding, and so I want to make sure that we get to the point where we can talk about the Disability Inclusion Fund, because, I would love to hear about that as a model. Forgive me for cutting you off. I'm just making sure that we don't miss that huge important part of the work that you're doing.
No worries. So we are the Disability Inclusion Fund is we actually just launched our rapid response funds today. So you can go to our website and get the RFP. And we really feel that it's important that we support disability organizations that are leading mutual aid and the important policy work, and that the work is directly addressing the COVID-19 pandemic. And one of the things that we're doing is we were trying to make the process accessible for everyone. So we are actually offering the application in large print. We're offering it to people to actually do it over a video call or over the phone. I think that's one thing that philanthropy can really do is to make the application process as accessible as possible. And I don't think that's something that people automatically think about when they're doing grant making. So we just really want to address, the long-term goals as well as short-term goals, and that, and we really believe that that funding is a long-term sustainable investment in disability inclusion and justice efforts. So please go to the website. I'm going to put the link in the chat.
Oh, Allison beat you to it. It's already there.
Okay, thanks. And hopefully we will be able to really make a big impact for organizations around the country who really need the funds right now.
Thank you so much for those insights, Nikki. And thank you, everyone, Maria, Nikki, and Patrice. I know that we have shared so much information today, and I'm the one who had to keep it all moving, although I know we could all honestly talk about everything for so much longer because there's so much to unpack here. That being said, I really appreciate all of your tireless work and your wisdom and your insight. So I want to leave some time for a bit of Q&A before we wrap up. And so please send those questions in the chat box, and then I will read them out to the panelists, and hopefully we will be able to address some of the important questions. So it looks like the first one is Nikki, actually. Can you please speak to the criteria for applying for the Disability Inclusion Fund's Rapid Response Fund?
Sure. So for the criterion is that the organization should be disability led. So it's the person, because we really want to make sure that we're that's in line with the values of the fund, and that they're directly addressing COVID-19, either through mutual aid or through policy work, and that we're planning on giving funds throughout the whole country, but we if there are particular hotspots, we will the hotspots will get some priority, although we really want to spread the money as far and wide as possible.
Thank you for that, Nikki. And also, I made sure that I added the right link to the chat box that has the announcement about the Disability Inclusion Fund. Sorry about that. So I think the next question, and some of these are some big meaty questions. So has or can the Americans with Disabilities Act be used to help essential workers with underlying conditions force employers to provide PPE and safer working conditions for them? So is that something that can be done? And then also, I would add to that the second question that came through from this person about broader policy priorities for the next stimulus bill. So Maria, I think I'll turn that one over to you.
Sure. This is a great question, and I want to preface this by saying I am not a lawyer. But for number one, has or can the ADA be used to help essential workers with underlying conditions force employers to provide PPE? The answer is yes. PPE is just one tool or accommodation that employees or essential workers with underlying conditions could ask for via the Americans with Disabilities Act. Another accommodation in addition to PPE is asking for telework or asking for leave due to the outbreak. One of the other things that we haven't really discussed on this call is what the COVID recovery process will look like nationwide. So right now we're focused on response, and eventually we'll be focused on recovery. One of the other things that's concerning the disability community is employees who may have conditions like cystic fibrosis that put them not only at risk but very high risk, that they should be able to remain in social isolation for a longer period of time and not be required to work because of their risk. But I would say yes, the ADA can be used to require employers to get PPE. I think the issue there, and this speaks to Nikki's point about the importance of funding both direct response, rapid response, and policy and systems advocacy, an employer may not be able to access PPE right now because we have issues with our distribution systems. So it's important for an employer to be creative about how PPE may be accessed and how they could support mutual aid networks like the one Patrice is working in to connect their employees to very limited PPE. And to the second question, so the disability community is organizing around a few priorities for the next stimulus bill. As I've already mentioned, one is around more funding for home and community-based services, and that includes increasing pay for care workers, increasing the support in general for people with disabilities to access care work, and for the availability of training for the direct support workforce. Another priority is around access to PPE and medications. creating more flexibility in medication refills, making sure that we can use the powers of the Defense Production Act to produce more PPE and more equipment for people that need it. And we are also really focused on making sure that all of the recovery funding that's going out to individuals is is distributed in an equitable way. A day and a half ago, the Social Security Administration announced that beneficiaries with dependent children would have to file a particular form and claim those children today at noon Eastern time in order to receive the $500 economic stimulus. They gave people, again, less than 36 hours notice, and so many folks are not going to be able to fill out that form online. We have seen consistent issues like this in the delivery of recovery funding. And so for COVID-4, we're making sure that all of those glitches, if you will, are repaired. And that's just to name a few. I will say we do anticipate an additional recovery bill after COVID-4, so we're already beginning to think about that as well.
Thanks, Maria. And so we have a whole heck of a lot of questions, and I'm just going to be real straight up with everyone right now. We have limited time. So I would highly recommend that if we don't get to your question, that you email it to our contact there, Allison, and we can try to get you a longer answer. And we're also posting resources on our website, which is disabilityinclusion.net. But one thing that I do want to make sure that we're bringing up, is in terms of how the media has been covering the stories of the disability community, or hasn't been covering the stories of the disability community. Where are the holes, and how can we fill those holes? So what are some key blogs or websites or places that we can follow and check in on to stay informed about developments within the disability community? So I would love to hear if anybody has any suggestions regarding that. And if not, I'm happy to jump in. I'll say so. You can check out the Disability and Philanthropy Forum that I was just mentioning. Right when you go to disabilityinclusion.net, on our homepage, we have a link at the top that links to a list of resources with articles and information that we're curating regarding the pandemic, the disability response to the pandemic, and also we've just created a new resource today that's available on the website now, actually, regarding examples of how different foundations are responding and what they're doing. So definitely be sure to check that out. And then also in terms of places to check for perspectives from the disability community, I highly recommend tuning in on Twitter. On our forum, if you are a member of the forum, we actually have a list of hashtags and people who you can follow on Twitter for further information. So that might be a really good place to start. And also, I am super biased here, but I'm the editor-in-chief of Rooted in Rights, which is a platform that's focusing on amplifying perspectives for disabled people, by disabled people, but also in a way that makes it accessible to everyone. So we have been doing a pretty extensive series of some of the perspectives filling the holes that are not available, or that are not being made available through mainstream media. So that is something that I think would help with that. Let's see, we can probably get to like one or maybe two other questions. I don't know, they're all big, hairy questions. So the next question, Nikki, can you just touch very briefly on how big the Disability Inclusion Fund's rapid response funding is, and then what other funders can do to make sure that needs are being met? I know that's a big question.
Yeah. So, the rapid response funding from the Disability Inclusion Fund will be about $200,000 that we're gonna try and push out for this rapid response grant. I think in general, like what other philanthropy organizations can do is, I think that listen to people with disabilities and what they need, and really try to send funds to those particular. We talked about many of those issues already today, like the mutual aid and the policy issues, and having funds targeted towards those particular issues. I think is really important for philanthropy to really get involved, and also to make your grants more maybe like general operating and not super specific, so that the organizations can really spend the money the way they need to spend it.
And also, just tacking onto that a little bit, how can the grant making process be made more accessible? I know you were talking about that just a little bit, but one of the questions that came in, was regarding from the application process all the way to the reporting process. Are there just a few key things that you can list about accessibility? And I'll also add, on our site, the new resource that we just put up about disability inclusive approaches to philanthropy right now also has some really good tips about that. So I'll drop that link in the chat box as well. But Nikki, if you have anything, that would be great.
So when we put together our application, I did a few things. Specifically, I actually tested our portal. I had someone who uses the screen reader and different types of screen readers test the portal. We also are we also have the application available in without having to go through the portal. So we're doing like a Google form application. Another thing is making it so that people can do the application over the phone. And another thing is we deliberately kept the application short so that it would make it more accessible for people. So people can also do like a Zoom call or a video call and do the application with someone over video. So all of these ways of just making it in all different types of forms and accessible for grantees to apply for the grants. And also thinking like we are not asking for a lot of reporting in response to the rapid response, because it's also an issue around just making things more accessible.
Thanks for that, Nikki. And in answer to the question that we just got about meeting notes and a list of resources, I'm quite sure that we can make that happen. I know there's a lot that we've packed in to this hour. And with 5 minutes left, I really quickly want to turn it over to Maria, Patrice, and Nikki, each for kind of like a 1 minute lightning round. What's one action step that you think that people in philanthropy can take now to lift up, to amplify, and to support the disability community, and any resources that you recommend? So it's okay if you're reiterating what's already been said. Let's drive those points home. So Maria, we'll start with you.
Thanks, Emily. I'll give 3 very quick things. One, make your application process and reporting very accessible. 2, to combat this pandemic and make sure disabled people thrive, it will take mutual aid and systems change working together, so be willing to fund both. And 3, think about funding priorities beyond the immediate response and long-term recovery. And I'll just add a 4th one. All disasters happen at the same time, and so be prepared to think through what will happen if another major disaster hits as we're all confronting this pandemic.
Thank you. And Patrice, I know you're sharing some great resources in the chat. What's your one key takeaway or action step?
Thank you. From our perspective, the greatest needs we faced are the need to uplift and center disabled leadership and to work with the most marginalized communities. Centering disabled leadership for us has meant working with groups and listen to and understand the needs of disabled folks and work as collaborators to support the work of disability justice movement. This can look like writing accessibility into an organization's yearly budget so that all your events have captioning in ASL. It can look like making sure, like has been mentioned by so many folks, making sure the application processes for funding are as accessible as possible. Even sometimes for our organization, even at times when we're able to get some funds because of how they are given, we're limited in our ability to support some of our community because of the negative impact it can have on folks' benefits. So it's also important to be willing to be creative and work together for solutions that ensure the greatest benefit for those most in need.
Thanks, Patrice. And Nikki, anything to add?
I think everyone said it all, honestly. I think for philanthropy, making your applications accessible, I think is really hugely important. And also, and just listening to the community as to what they need and really directing funds towards the actual needs of the community.
So I know that we have just marched right on through this today. Talk about rapid response. This was very rapid. But I really, really appreciate everything that everyone shared and said today. And to wrap up very quickly, I want to thank everyone for tuning in today for such a powerful and important conversation. I'm especially grateful to our panelists who have been absolutely incredible and insightful and so generous with their time. And I ask everyone to keep in mind that as you're planning for this continually changing environment, please be sure to continue to hear what the disability community has to say, and indeed what we've been saying all along. You know, in the spirit of the motto that we often use, nothing about us without us, remember that disabled people need a seat at the table. Bring them into conversations, bring them into consultations, not just regarding your rapid response grant making, but also to shape a more inclusive future for your foundations. If you are looking for resources, again, disabilityinclusion.net, and right there at the top, you'll see a red link to an updated curated list of disability and COVID-19 resources, including a new resource we just put together on the philanthropic response and examples of how you can respond in a disability inclusive way. So check that out. Of course, please inform your grantees about the Disability Inclusion Fund's rapid response grants. And most importantly, it is 1 o'clock Eastern time. So please take care of yourselves during this difficult time. Continue to tune in to the Disability and Philanthropy Forum. We're going to be here as you navigate these uncharted paths ahead. We're going to create space for learning and sharing guidance on how we can all find our way forward on this journey together. So thank you so much, everyone, for joining, and stay healthy and take care.